Everybody, how y'all doing? How y'all doing? Wow, it's been a minute. It's been a minute.
It has.
Well, welcome back to Dialysis Lifestyle, man. It's your boy Daryl with Dr. Awosika.
Hello, everyone.
And y'all know what it is. I mean, we talk about CKD, kidney failure, kidney experiences, dialysis experiences, and just life overall on dialysis. Today I want to talk about the people that are actually going through this disease and having to do dialysis incarcerated.
Incarcerated or not in an environment that is what they would regularly choose to be in. So they're incarcerated or third world countries where they're in war zones, right, or they're just not having it as easy as many of you that might be listening to this are having it. You're doing it in your home, or you have a center down the road from you, or maybe you have to travel 10 miles away. Perspective is everything.
Indeed.
Everything. Your viewpoint. And what's the biggest factor that determines your perspective? Your experiences. You could experience something tomorrow that will change the way you think about filming things forever.
Indeed. Indeed. But in jail, is so dehumanizing. You know what I mean? Like, they literally do dialysis. First of all, I thought that if you were in jail and you have to do things like dialysis or chemo, they take you to a hospital.
They don't?
No, they don't.
Oh.
They don't. They do not.
So I guess they take you to infirmaries within the jail system, which is not quite a hospital, like a sick bay.
It's not even it's just like it's a clinic side. It's a clinic side that they take you to. They bring in mobile dialysis nurses, and they perform dialysis on patients under the hospital as the biller. So the hospital bills, whether it be government assistance or your insurance or whoever pays it, the hospital pays because the doctors work for the hospital, and then this company comes in and gets paid under the jail through these companies.
So what's the environment for dialysis like?
The environment for dialysis is despicable. One, because you're only given the time you're on the machine. There is no, if you do 3.5 hours on the machine, you do 3.5 hours on the machine, and then you're right back to your cell. There is no eating. There is no
waiting for your blood pressure to come up, or
waiting for your blood pressure to come up. There is no drinking water if you need. Like, there is nothing. You literally go back to your cell, and you're just there.
Wow.
You're just there.
Wow.
There's nobody checking on you. There's nobody. It's just horrible. It's just horrible.
Wow.
It's just horrible. And then the worst thing about it is that in jail, there is no, you eat breakfast at 6 a.m., you eat lunch at 11, 12 p.m., and you eat dinner at 6 p.m. So if you do dialysis, let's say you do dialysis at 8 o'clock, you eat when lunch comes. And then your renal diet is not even an issue in jail. You're getting whatever everybody else is getting.
Wow. And again, that's perspective. So with that perspective, it makes you have a fresh appreciation for being able to dictate your own environment, being able to dictate the environment you're in.
Indeed.
As in, when your freedom is taken away from you, and you get your freedom given back to you, you have a newfound respect and appreciation and gratitude for something that we all take for granted, like freedom.
Right. You have a new hunger to strive.
Oh.
You have a new hunger for it.
New hunger to strive. Everyone needs to get that. A new hunger to do better, to strive for more.
Yeah.
Wow.
Yeah. People told me I didn't take a break at all. But now, it's like I have so many, my mind is like, it's just bouncing all over the place. Because it's so much things that you appreciate the time that you have and the capability and the freedom to do what needs to be done. Because it's nothing like sitting down and having no option but to sit down.
Oh.
There's nothing like it.
when you're in a space where to exit that space, you need a key that you do not have.
Right. Literally.
If
Literally.
a friend of mine, not a friend, someone that's very close to me, super close to me, he gets PTSD when he hears keys jingle. So that's the jingle he used to hear when they're opening or locking his cell. So he hears keys jingling just outside in the car. You know, it takes him back to that place.
I could understand that.
PTSD.
I could understand that.
I mean, he said, even if you give me the keys to a Ferrari, if it's going to jingle, I'm going to go back right there. Mentally, for a time. I have to will myself back to where I actually am.
I can see that. I can genuinely see that, because you're handcuffed while you're doing dialysis.
Oof. Oof.
Your hands are handcuffed, your feet are handcuffed, and you're on a dialysis machine.
Why are we doing this? Why are we discussing this? Why are we being so transparent and vulnerable?
Because I just went through a personal experience to where the law didn't do what the law was supposed to do, and because of that, I had to face the punishment. You know what I mean? Like, in the United States of America, they love to push that innocent until proven guilty, when it's the complete opposite. You're guilty until proven innocent.
You're guilty until you prove that you're innocent.
That's literally what it is. And
Wow.
through my experience, it has shown me that you don't have to be a criminal to be in jail. I have never been arrested for doing something illegal. My record is 100% clean when coming to doing something illegal, but I've been to jail 6 times.
Wow. For this same problem.
Same exact problem. Because when I first got into problems, I wasn't able to financially afford court and lawyers and all of this. So they offered me probation so I don't have to go to court. I couldn't afford to go to court anyway, so instead of going to court and losing with no lawyer, I took probation. But when you're on probation, that's literally a free way for them to just punish you for anything.
Because anything, you're not vulnerable to anything.
Anything. You don't have to commit a crime to violate. You just have to violate. And violate can be something as simple as interaction with a police officer.
Eesh. Wow.
You know what I mean? It could be anything. You could be jaywalking. You can spit on the sidewalk. You can throw trash on the floor. You can be speeding 10 miles over the speed limit. You can be anything. And they can violate you. And the worst part about it is when they violate you for probation, you can't get out until you see the judge that signed that violation warrant.
Wow. You know, I hear things like this, and you know, it just brings to me the fact that we're all doing life together. We're all living on this same planet. And to a large extent, we can dictate our environment. But sometimes life happens and less desirable people or situations, well, I'll say people, come into our lives and cause a situation where you cannot dictate your environment.
A lot of times.
And when you're in that situation where you can't dictate your environment, the biggest thing is to have reserve, some capacity to influence how that person is affecting your environment. It might be someone you know, it might be some situation that you know, some leverage that you have to either get that person out of your environment or change your environment. Because at the end of the day, no matter what happens to you, you are responsible for your environment. And it sucks.
I don't, because, all right, so for instance, my previous situation, I was at the courthouse making paying court fees, had an interaction with police, got arrested for violation of probation, right? Ended up in jail. Once you end up in jail, that is one time in life that you're not responsible.
Absolutely.
And the crazy part is, it's easier to get more time in jail than it is to go to jail.
It's easier to get more time in jail
than it is to go to jail.
Actually go to jail.
Right.
Wow.
Because what people don't fail to realize, you can go to jail for driving with a suspended license. If you go to jail and somebody tries to fight you and you defend yourself, that's more time.
In jail.
The only way to not get in trouble, to defend yourself, is to not fight back.
Wow.
There's no excuse for nothing else. If somebody punches you in the face, the only way you don't get time, and you have to prove that they punched you in your face, which is snitching.
And you get to trouble for that.
So it's either you get in trouble with the inmates or you get in trouble with the COs. But either way, that's more time, and you're here for a suspended license. Because there's no separation in burglary and armed robbery and attempted murder. You're all in county jail together.
Wow. And here you are thinking, you're watching this thinking you have problems in your life. You have problems going on around you. And you probably do. This is life after all. But perspective is everything. Having your freedom taken away from you makes whatever you're going through 10 times worse. So having your freedom while you're going through what you're going through, be appreciative of freedom. Be appreciative of having a say in your life. Dialysis makes you think you don't have a say in your life anymore. Some people have said that to me, that by having to have dialysis 3 times a week, they feel they're chained to a machine and they have no say in how they, what kind of life they have anymore. I say, no, that's not correct. If you have that mindset, you're already defeated. It's very important to see dialysis or anything that you have to go through to be your best self, especially health-wise, yes, that you have to go through it, see it as a lifeline. See it as another chance to live better. Don't see it as you're being jailed, or don't see it as your life has been taken away from you, because it's not. You have to think of things the right way. I would say the narrative you tell yourself determines so much. Because if you tell yourself that by being on dialysis you're being jailed, versus telling yourself by being on dialysis you're being given a lifeline, a second lease at living, you think about things very differently. You experience that thing very differently. And you want to experience that thing the best way you can, so you have the best outcome as a result of that thing that you have to do.
All right, so one of the other guy that was doing dialysis in jail with me, right?
Mm-hmm.
He told me the reason why dialysis was hard for him is because he never had to give that much time to anything else in life that he wasn't financially compensated for. And when he said that, it made sense. Because a lot of people go through life, and the only time they dedicate 8 hours to something consistently
It's being
is
exchanged.
work.
Exchange for money.
Financially, right. So now when you add something to somebody's life, and there's no immediate financial benefit to it, it's like it's a task now. Mind you, you'll get up and go work 8 hours a day for that paycheck. But outside of that, you don't go to the gym. You don't put time aside for your spouse. You don't have date nights with your kids. There's nothing that takes time consistently from you outside of that. And when you think of it, that makes a lot of sense.
It makes a lot of sense.
Because a lot of people, the only time they actually set aside time consistently is work.
To work. So that goes back to the narrative you tell yourself. Because if you have to get that kind of exchange, or let's refer to it as immediate gratification, that's what it is.
Right.
You're seeing the results of the work you're putting in. But if the results of what you're putting in is going to give you a very fantastic marital life, or it's going to give you a fantastic bill of health, or it's going to give you, make your kids or your parents or whoever it is that's benefiting from the time, energy, and sometimes even financial input, if you're doing those things and is leading to those things, you're more able to do those things. But if you're thinking there's no immediate gratification, and you can't discipline yourself towards delayed gratification, it's shortchange yourself.
But that's a problem that a lot of people deal with. Because
Absolutely.
all right, imagine those that are overweight, and they know they want to lose weight.
Yep.
They know the gym is a good way to lose weight. They have access to the gym. It's across the street from their house. But are they getting up every day and saying, you know what, this is the life I want for me health-wise. I'm going to go and put 2 hours in every day in the gym to make myself happy and healthy.
So the question now becomes, do they know that? Because if you know better, the tendency is you do better.
Correct.
And of course, if you do better, then you have better. But if you don't know, now if they know those things, the way you just put it, and they don't do it, their outcome's on them. Period. Now, if you don't know, that's different.
Right.
If you need to learn it and you're hearing for the first time now, get to the gym. But if you do know it and you don't do it, who are you going to blame but yourself?
So what's the difference with dialysis?
Again, knowledge.
Right, but nobody gets on dialysis without knowing dialysis. Even if you don't know even if you don't know how you're going to feel after dialysis, even if you don't know the actual procedure of what's going on with your blood, what we all know is without dialysis we feel bad. With dialysis we need dialysis to feel better.
Do we all know that?
We know that.
You
Because
sure?
we all know that.
Because
if you don't know that and you have kidney failure, all you have to do is don't do dialysis.
So, did you hear that?
That's all you got to do.
Because I've had patients, I'm telling you very clear, doc, and this happens almost every day. I say, listen, to feel better, we have to increase your time on dialysis a little bit because you're not getting good clearance. Mm-hmm. We're not clearing your blood properly with the amount of time you're doing on dialysis. So we have to make your time a little longer. I get every single time, no, doc, that's going to make me feel worse. You heard it. Sometimes the only way you will remember, you need a reminder as to how you feel without dialysis. Skip it for a few days.
That's it.
Gets you feeling bad, come back to me so I can dialyze you for a few days in a row. Get you feeling better. Now, to dialyze you consistently and get you to your best state, which as you said in the past might be 85% of your best state, right? To get you to your best state, sometimes you have to increase your time on dialysis. But I hear it all the time. Even though people know that they have dialysis a little longer, they will feel better, they argue that they would. You know what I'm saying?
I understand, and I can understand the mental capacity of that too, but what dialysis patients need to know is if you do dialysis more, you're capable of doing less. Let me explain. When you do dialysis 3 days a week and you have all this fluid, you have to take off 4 and 3 and 5 kilos of fluid. If you do dialysis 5 days a week, now you only have to take off 1.5, 2 kilos. That in itself is a better feeling. Taking off 1.5 during a treatment is a 10 times better feeling than taking off 4 and 5 kilos.
Are you guys listening to this guy? Because everyone on dialysis needs to hear this.
But yeah, because it's like we do more, but in your mind you have to understand doing more gives you the freedom to do less. The more treatment you do is the less fluid, the less cramping, the less everything that we complain about on dialysis, it's less. Yes, the treatment is more
Frequency.
But as far as everything else, watching your fluid, worried about cramping, watching your phosphorus, all those things become minimal.
Wow, that's very well said. This is an ad for more dialysis. Period. More frequent, because doing it that way, you're resembling much more what your body would naturally do. Your kidneys work 24 hours a day, every day. Even while you're sleeping, 24 hours a day. Doing what the machine is supposed to do for you for 3, 4, maybe 5 hours, 3 times a week. It's tough. And your body does better with small shifts. A little bit of fluid on, a little bit of fluid off. A little bit of fluid on, a little bit of fluid off. Not a lot of fluid on, a lot of fluid off. If you're driving like that, you're all over the road. You gotta be consistent.
All you have to do is try to mimic a real kidney. Small amounts of fluid. So if you're doing dialysis and you're taking off small amounts of fluid, it's more mimicking a real kidney than anything else.
Well said.
4 kilos is a lot of fluid. If you take off 4 kilos or 5 kilos on the regular, go in the bathroom, fill up a plastic bag, fill up anything, and weigh it. See how much 4 and 5 kilos of fluid truly is.
Wow.
Because a lot of us just take it off.
Wow.
And if we let the machine work, and we don't even know what it really looks like. Do yourself a favor. Go and weigh 4 to 5 kilos of fluid.
Let's get a gallon jug.
Yeah.
1 gallon. That's 4 liters of fluid. Fill that up.
Yeah.
Okay, fill it up. That's good. Because the reality of it is the body can take so much. It can. But there are consequences to the body taking so much. releasing all that fluid in a 3-4 hour period, as opposed to releasing it over a 2-day period, is a big task on the body.
Big,
Huge task.
huge.
So dialysis is doable, guys. He's doing it the way it should be done. And he got to experience the way it shouldn't be done for a short time, thankfully. A short time. But that was enough to give him a fresh perspective.
Yeah.
A fresh point of view that he didn't have before. Hopefully with this, we're giving you a fresh point of view. Because at the end of the day, I want to do anything that adds value to you, as does Daryl. That's the whole idea of this. How can we add value to you? You on dialysis, you that has kidney disease, you that has any medical condition is suboptimal. But there's certain things you can do to make your situation the best state it can be in, so you're better equipped to deal with that situation that you don't have any say in.
Right.
You have a say in what you're eating. You have a say in what you're drinking. You have a say in going to the gym. You have a say in your sleep. You have a say in the relationships that you're in. You have a say in how you manage stress. People say avoid stress. I say then just kill yourself.
Yeah.
You can't avoid stress, but you can manage stress.
Yeah, it's impossible. It's impossible to avoid stress. I could say this though. Right now, I currently feel the worst I've felt in a very long time on dealing with CKD. And there's no other explanation for it except for the last previous couple of weeks, I've had to do dialysis 3 days a week.
Wow.
And before I was feeling perfectly fine. At minimum, doing 5-6 days a week. At minimum. And I take off a kilo, at most, 1.5 kilos per treatment. But now, from these last couple of weeks having to go to dialysis, I haven't taken off 3.5 and I don't know how long.
Your body was like, what?
My body still is like, what? Like right now, it's still like, what? Because I don't feel like this. I haven't felt like this in a very long time. And if this is how I feel for doing dialysis 3 days a week, I'm good on that. I'm good on that.
Wow.
If this is how I feel for doing dialysis 3 days a week, taking off 3 kilos, 3.5 kilos, I don't want
going back to this again.
I don't want that. I can't.
So for those of you that are getting dialysis now 3 days a week, this is something important to hear. Because you don't know the power of dialyzing much more frequently until you do it. You're hearing it from someone that's doing it.
Yeah,
yes? But you really can't experience it unless you do it. Do it and see how you feel consistently. Do it. Get set up with home dialysis. Get some with home hemodialysis or even peritoneal dialysis, where you're dialyzing daily.
Right.
You're clearing your poisons every day. That's why I tell people, ideally, how frequently should you poop? How frequently should you poop ideally? It's a little differently on dialysis, because dialysis dries you out.
Right.
But ideally, how frequently should you poop? You should poop 1 poop per meal per day. You have 3 meals, you should poop 3 times.
Wow.
Yes. Now, how do you do that? You have to increase your frequency of pooping by increasing the amount of fiber you take in. Fiber from vegetables, fruits, and beans, and lentils, chickpeas, hummus. More water every day. Not if you're on dialysis. More. People are very clearly out there. If you're not on dialysis, more water. And then movement. More movement. Exercise. I used to run marathons. And when you start a marathon, the first 2 or 3 miles, everybody's going to the bathroom. Everybody's going to the bathroom. Because when you move, you stimulate your bowels to move. So you got to poop more frequently. And pooping more frequently is a sign to me that you're living well. You're eating the right things. Guess what constipates you? Animals. What's an animal? If it flies, it swims, it walks, it crawls, it's an animal. All right?
Breathers.
All animals, it breathes.
Right. There you go.
It breathes. All animals will constipate you. What's my point with this? The fact really is that you want to do things to clear the system. Dialysis, clearing the poison is important. If you're not on dialysis, pooping is very important. Urinating is you're getting rid of stuff you don't need. That's why water is so important. Water takes things to where they should be, but it takes things away from where they shouldn't be. That flow is crucial. Same thing with blood. The flow, anything that blocks blood flow to coming to it, leads to death. The heart muscle You get a heart attack when the blood flow is impeded, a stroke. When blood flow is obstructed, you get a stroke. Circulation in your limbs, erectile dysfunction. It's all from a lack of blood flow. So flow is key. That's why with dialysis, you get better treatment, you get better well-being, you feel much better if you're doing it on a consistent level, which encourages regular flow. Not 3 days a week, where you do massive shifts. No, regular flow 5, 6, 7, 8 times a week. Like the kidney does it. 24 hours a day. Small amounts of urine being made every minute. That's how it's supposed to be.
Yeah. I agree. And consistency is key.
It's crucial.
Consistency, because I feel so sluggish and tired and drained and weak, and I don't feel like this.
I can't wait to do this again next week because
I normally
because
don't feel like
the way you feel, I want them to see it
Yeah.
and experience what you're feeling and the difference 7 days is gonna make.
Yeah, I normally don't feel like I'm up on it, and now it's like every time I'm thankful to get a break.
Wow.
Like before we started and you was on your phone, I was just laid back like, let me just take this in because I'm tired. I'm genuinely tired. And I know it's because I took 3.5 off. But I had to because I wasn't doing dialysis.
Absolutely.
So my fluid, like my dry weight is way higher than it's ever been. So now I'm doing...
Has ever been since you've been doing it at home.
Right. You know what I mean? So right now my dry weight is so high that even though I'm doing the dialysis consistently, I'm still taking off 2.5, 3, till I get my dry weight back to where it was, to where I can go back to taking 1, 1.5. But it's not going to get there until I get back to doing dialysis consistently for a couple of days straight.
Wow. That sounds some questions. I don't know if there are any questions coming up.
There's one young lady asked, she said, what can she do about, what can she do for her arm that keeps shaking to do dialysis?
Her arms keep shaking
Yeah.
while on dialysis?
Uh-huh.
Well, you got to find out why your arm is shaking first. Is that a brain problem? Is that a problem with electrolytes?
I don't know.
Is that a problem with you being dehydrated, taking too much fluid off?
It's just something I seen. And then here go another lady. She said, I live in Jamaica. I can only pay for 2 days. You got to pay for dialysis in Jamaica?
You pay for dialysis everywhere. In Nigeria, where I'm from, sometimes you choose between dialysis and buying your prescriptions or eating. You have to pay.
I didn't know.
America has it the best way. Well, that's not true. Europe, some places in Europe have it even better. But here in America, that is one of those few procedures that the government would usually pay for. So yes,
She said she could only afford to pay for dialysis 2 days
twice
a week.
Back home,
Ouch.
it's twice a week in most cases as well. Because 3 days a week, most people just can't afford it.
Ooh.
Let me see, what other questions? I know there's some
You ever
questions
try
here.
going an extra day for a few hours?
Yes.
I try. I don't try. I do that faithfully every week. Faithfully every week, I do more than one for a few hours because the more I do dialysis, is the less fluid I have to take in. With me, my biggest thing was always fluid. So once I realized that I can, because now I don't even pay attention to my fluids because of how often I do dialysis. I don't have to because I can't put on, well, I can, but I don't. I'm not going to put on 3-4 kilos daily.
The only reason why you want to do longer dialysis than usual is you have too much fluid on. Because the rate at which the fluid comes off is what determines how you're going to feel.
Gotcha.
So you're going to take up 2 liters of fluid in 1 hour, you're going to feel worse as opposed to taking up 2 liters of fluid over 4 hours. Because you take up the fluid slower, your body's able to tolerate it coming off that slowly. But if it goes suck it out so quickly, you're going to feel it. You're going to cramp, your blood pressure is going to drop, you're going to feel nauseous. All symptoms from being dehydrated. That's what causes dehydration. You're taking fluid out of the vessels, and you're not waiting for fluid to move from outside the vessels into the vessels.
Doc, somebody's about to get a PD catheter. Will that work as good as home dialysis?
Yes. A PD catheter is, if I was going to go on dialysis, I want to do PD first.
Okay.
Because PD more closely simulates what happens with the kidney. It allows for fluid shifts to be gradual, as opposed to sucking it out with hemodialysis.
What should my speed bump be? I have a fistula.
What should my speed bump be?
Yeah, I don't know. I guess it's the speed rate on the dialysis.
Oh, your speed rate. It was going to depend on you because the rate at which the blood flows all depends on your heart. If your heart is weak, you don't want it to be too fast. If your heart is stronger, you can make it as fast as you can because the faster you make the blood flow, the better the dialysis.
Gotcha.
Dialysis happens better if you can make your blood flow quicker so the poisons exchange faster.
Gotcha. Okay.
Good deal.
Yeah, man.
So, I mean, I really want this to take home from this for me, guys, is let's look for ways to be appreciative and grateful for what we currently have. You might be going through a rough time on dialysis or chemotherapy, or I'm currently getting radiation therapy for my prostate. You may be going through whatever you're going through that you'd rather not go through. But while you're going through it, look for things that you're actually grateful for, like freedom, being able to do it at home, or being able to go down to a unit and do it, being able to drive there and drive back home safely. There's so many other factors that come into it if you're in different parts of the world or in different situations. So an attitude of gratitude elevates you every single time. No matter what it is you're going through, look for something in that negative period for you to be positive. It will help you bring you out of that negative thing you're going through. That's what I want to send you home with today.
Is it safe to take off 4 liters at a time?
Is it safe? It's not desirable. It can be done. I've had a patient remove 8 liters in one treatment. Over 5 hours. But if he didn't, he would have been in the hospital. And it was a gamble. I didn't want to do it, but he was insistent, and we let him do it. Now, he hasn't done it ever since then, because he would have ended up in the hospital if he didn't. He was just full of fluid. But 4 liters is not ideal. Ideal is 1 liter per day. So if you have a 2-day period between your treatments, you shouldn't take off more than 2 liters. If you have a 3-day period between Friday and Monday, you shouldn't have more than 3 liters on. When you start going above 3 liters, if you're going to do 4 liters, make your time longer so that the fluid comes off slower, so the body can tolerate the fluid coming off slower, much more than it'll tolerate the body just being sucked out quickly.
I'll say this, and correct me if I'm wrong. If you're taking off more fluid, so if you're taking off 4 kilos, and you're not even doing 4 hours, you're doing something wrong.
Absolutely. You don't want to take off more than 1 liter per hour.
Yeah.
Ideally.
Yeah. And I don't even want to take off that.
Yeah, that's a lot.
I don't even want to take off that.
That's a lot.
I'm doing 3 to 3.5 hours. I want to do half of that in fluid.
Exactly. That's ideal. The body does much better with that.
And you feel 10 times better. I know a lot of us say, well, I'm only taking off 3.7. I'm only taking off 3. I'm only taking off 4. I promise you, if you get down to taking off 1.5 to 2 kilos per treatment, it's another feeling.
It is.
It doesn't even feel like you did dialysis.
It is. It's definitely another feeling. So I really want to encourage that. Decrease the amount of fluid you're putting on, so we have to so we end up taking less fluid off.
And if you need to drink more fluid, then you need to do more treatment.
Period.
Yeah.
Both frequency and time,
Right.
but especially frequency.
A young lady said her mother just got on dialysis. Her fistula got bruised real bad. She's thinking about putting her on home dialysis.
So that won't fix the problem though, because she probably had an infiltration where the needle goes into the fistula and goes out the back end, or it goes by the side of the fistula and they're digging around there and blood collects there. It's painful, it's annoying, but you're dealing with very experienced people that cannulate. Now, unless you're more experienced than they are, you can have that same problem at home. So it's going to be technique and letting them know what happened so they can correct it in dialysis. Maybe get someone else to cannulate you.
I also say doing home dialysis, nobody treats you better than you treat yourself.
Well, true. But then if you don't know how to treat yourself.
I mean, they train you though.
Okay.
Yeah, they
so
train you.
so again, if you don't know how to treat yourself, then you're still worse off. But
Oh, yeah,
if
definitely.
you get trained and you become as proficient as you have become, then you're absolutely right.
Because that's one of the biggest things for me with home dialysis. I can do home dialysis that often because I've learned how to cannulate myself to where the pain is very minimal. So I can go on treatment twice in a day and it won't bother me because I don't hurt myself. You know what I mean? So I could do dialysis in the morning, know I went to an event, know I was outside in the heat, know I did a lot of fluids. So I'll go on for 2 hours at night and it doesn't bother me sticking myself because I've learned how to stick myself best. I mean, I have had my catheter, my fistula since I was 17. And I've never worked on it.
Wow.
I've never had an issue. And it's the same catheter for the last 20 years. You know what I mean? So
When he's done ultrasound that fistula?
we have.
Recently?
We have, yeah.
Okay.
Yeah, like I mean, we do ultrasounds on it, but as far as like touching it, having somebody take it down,
Right. Nothing.
none of that.
Good.
None of that.
Awesome.
None of that.
Fantastic. Any other questions?
I love my dialysis clinic. They really treat us with the utmost respect. Our
Good.
pain is their pain. I love it.
That's awesome.
I love it. If you got a center like that, be thankful.
Be thankful.
Yeah.
Let's pick up that center. What's the name of that center so we can bring them up?
Let's give them
That's
a shout out. What's the name
That's
of their
awesome.
center?
That's absolutely awesome.
Let's give them a shout out.
That's a big deal.
Oh,
to be
man.
treated with respect and care and love, it's a big thing.
Yeah, Biggest Heart says she loves her dialysis center. Her pain is their pain. I love that.
That's fantastic.
I love that. I love that.
You all should be looking for centers like that.
Yeah.
Okay? Don't be tolerant of being disrespected and treated poorly. Having said that, there are ways you'll communicate that to them. I always tell patients that the best treatment you're going to get is going to come as a result of how you treat your caregivers. You want to treat your caregivers in such a way that they want to take care of you.
Fresenius.
Which one?
Which Fresenius?
There's several ones.
Yeah. How long have you been on dialysis? I've been on dialysis since I was 18. I am now 39, so 21 years? Ouch, Jesus. Yeah.
That's a long time.
Yeah.
He started dialysis my second year in practice.
Yeah.
I've been in practice for 22 years.
Yeah. Some patients are rude. Exactly. Some patients are so rude.
Absolutely.
Virginia, Fresenius in Virginia.
Big up for Fresenius in Virginia.
Wow.
Big deal.
That's what's up. Fresenius in
Big
Virginia.
deal. Big deal.
Yeah, some patients are rude. I mean, I can understand that. I can't even say I wasn't one of those patients at one point. I can't even. At one point, I was one of those, but I was one of those patients because I lacked the information that I needed. I lacked the proper knowledge. I lacked the proper guidance, and I wasn't getting it how I needed to get it to understand. I was getting it, but I wasn't getting it how I needed to get it.
Got it.
So,
Interesting point.
yeah.
And when you consider the fact that I was his doc, that leaves a deficiency in me because I try to reach my patients, whatever, no matter what problem you're having. But with dialysis, it's a very special population because you're starting a new journey, and I'm learning myself, and there's certain things that have to be communicated to you. Certain things you take for granted, such as the fact that you're entering a whole new world where you're going to be on your own, lonely for a minute, until you're able to communicate with people that live on a different planet from you. Because if you're not on dialysis, you're living on a different planet from someone that's on dialysis. So being able to communicate with people that are on a different planet, well, it's a process. So that discussion has to be had.
Indeed. All right, y'all.
Fantastic.
Well, I mean, y'all know what it is. We are Dialysis Lifestyle Podcast. This is Dr. Awosika. I am your dialysis patient, Daryl. All right, and we are here every Thursday to go live to talk CKD, talk kidney failure, talk dialysis, talk the life experience of dialysis, and how it affects us, period. Feel free to reach out any Thursday that you have questions for Doc. You might have questions for me. Dialysis Lifestyle, as some of y'all already do, you can inbox me. I'm willing to talk at any time if I can help. If you have any questions, feel free to reach out. And that's what we do, man. That's Dialysis Lifestyle. Stay tuned. We got a lot more coming and a lot more things to do. We got dialysislifestyle.shop. So if you need any access, remember, dialysislifestyle.shop. We give access for your access. All right? So if you need it, come shop with us. All right? Till next week, Thursday, y'all. Love as always, and we out of here.
Take care, everybody.
Whew.
Awesome.
Poor Curtis.